There are a bunch of principles, there are 10 of them, that really help to describe what we do and why we do it in CBT. So the first one is CBT is based on an ever-evolving formulation of the patient and his or her problems in cognitive terms. So we're constantly looking at the patient as he or she evolves in the treatment. We're looking at current thinking, problematic behaviors, precipitating factors, that's different in each situation, developmental events, and we'll talk about that when we get into the core beliefs a little bit, and enduring patterns of interpreting. So the way that we interpret events, we have patterns of the way that we attach meaning to certain things. So we're constantly looking at that every single session all along the way, and we believe that this develops and evolves over time. So a CBT requires a sound therapeutic alliance. Okay, so this is really, really important in CBT, just like it is in most other therapies, right? We say that in CBT, it's a relationship of equals between the client and the therapist. There's no hierarchical kind of value based on the relationship, and we really work as partners together. So again, like I said, it really emphasizes a collaboration between the client and the therapist and active participation. Especially, so in the beginning, maybe the therapist might be a little bit more active, but then as the sessions go on, the therapist will kind of wean herself back, myself or himself back, and the client will begin to do more and more. Okay, and so become more and more independent. It's a very goal-oriented and problem-focused therapy. We're constantly looking to change behaviors and change cognitive patterns in order to be able to change mood. So it's not very process-oriented. We're constantly looking to make changes. It initially emphasizes the present. So a lot of other therapies, and maybe some of the therapies that you guys are in the practice of doing. So, and you know, there is a place in CBT for this. There are a lot of myths about CBT, that it's not emotional enough, it's not compassionate enough, you don't look at kind of the beginning and how all of this stuff developed, but there is a time and a place. But in the beginning, when we're really trying to make some changes, it's very present focused. The reason we do that is we want to make some changes in the beginning so that we have some wiggle room, so that the client kind of is moved a little bit outside of their current emotional state so that they can do the work and really go and look at the past and understand how all of this evolved. And we'll talk about that again when we talk about core beliefs. Cognitive therapy aims to be time limited. This is one of the differences, one of the big differences from psychoanalysis or psychodynamic therapy. We try to wrap things up by about 13 to 18 sessions, with then having them come in every other week and then maybe once a month, and then just calling in for booster sessions as needed. Now 13 to 18 weeks, that's kind of an average, and at the same time a lot of people do stay longer. I have clients who have done, for instance, they started with me doing DBT and then they transitioned into CBT, and then they did CBT for about 6 to 8 months, and then they started coming in once a month or once every other week. So that's just an average, and it really depends on what you're coming in with, of course. It's educative, and it aims to teach the patient to be his or her own therapist. This is very, very important. So when they come into CBT, we give them like a toolkit, and we give them a kit, and we build on the tools that they can learn all along the way, and these are tools that they can do at any time. They could be at work and pull out a thought log, which we're going to go over, or they can sit down and do a responsibility chart really quickly to see, you know, and really check themselves and check their patterns of thinking. They can implement behavioral activation every weekend. So they walk away with tons of tools that they can implement and become their own therapist. We even teach them when they go into doing, coming in for sessions every other week or once a month. We have a whole termination opportunity to teach them how to become their own therapist and actually conduct their own therapy sessions using a worksheet. And it uses this agenda as well. So they sit down with themselves and they go through this agenda. They have all the worksheets they need, and they really do like an hour-long CBT session on themselves. So it's structured. This is the structure. They don't come in. It's very different from, you know, just coming in. I remember I used to do this. I'd go into my therapist's office. It was very psychodynamic, so I'm surprised to this day. But because I'm such a CBT and DBT therapist, and everything I do in my own sessions is so structured. So, and I was used to it, and I'd go in there and I'd have no idea what to talk about because I was so used to kind of the structured format. So this is the structure. Clients come in, they do a mood check, they do a quick update on what's going on in the week. And in other therapies, especially for me, my update ended up being the entire session. But the update, we ask them to keep it to 1 to 3 sentences, actually. Sometimes most of the time, I actually give my clients a session bridging worksheet that I ask them to complete before they come in, so that this structure is in place and they don't have to think about how am I going to summarize this so quickly. And in the session bridging worksheet, they talk about, they give the brief update, and I really allow them only 3 lines so that they can't go on and on. I tell them, do not go on the back of the page. And so that's why they're able to quickly summarize it. And it takes lots of practice, actually, so this doesn't happen overnight, especially if they're coming in from a different modality and they need to be reoriented to the CBT process altogether. We teach patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. Okay, so this is where the C in CBT, cognitive behavioral therapy. We're looking at the cognitions, and we're looking at whether they're accurate, whether they're grounded, whether they're rational, and then we're teaching them how to actually go ahead and modify their cognitive patterns. And we'll do that. We'll look at the thought log today. And we use a variety of techniques. I'm going to go through some of them today, but there are endless CBT techniques. Some of them are cognitive, some of them are behavioral. Once you become, really seasoned at doing CBT, you come up with your own techniques, and so there are endless techniques to use to work on different things.